Does the name Li Wenliang ring a bell to you? It should, because that's the name of the brave Wuhan doctor who tried to warn the medical community there about a virus that you and I now call COVID-19. Now, he didn't get a pat on the back for his whistleblowing efforts. No, instead, he received the accusations of severely disturbing social order and then was silenced by his government. He also didn't get to live to see just how fast that virus would spread across the globe, bringing the world to its knees. BBC News reported that sadly, shortly after his whistleblowing efforts, he died from the virus. Drea Humphrey here with Rebel News, and today we are looking over a similar type of censorship happening right here in Canada, in our own backyards. One of our frontline doctors, Dr. Kulvinder Gill, has also found herself under immense pressure to stop sharing her medical opinions via Twitter. CBC News is one of the media outlets that have focused on the criticisms of Dr. Gill rather than the substance of her claims. CBC stated that they did try to reach out to Dr. Gill and received no response in a report where they reviewed 2 email complaints as well as interviewed 2 doctors who disagree with Dr. Gill's controversial Twitter posts. One doctor, Dr. Alex Nataros, is a BC family doctor who filed an out-of-province complaint against Dr. Gill to the College and Physicians and Surgeons of Ontario. The other family doctor interviewed by CBC is named Dr. Michelle Cohen. Regarding Dr. Gill's Twitter account, where she goes by the name of Kulvinder Kaur MD, Dr. Cohen claims she was shocked to read some of Dr. Gill's tweets. An example of such tweets is this one that reads, "If you have not yet figured out that we don't need a vaccine, you are not paying attention. Facts, not fear." Dr. Cohen says to start fermenting distrust of a vaccine now before one has arrived is dangerous. Well, I'm confused, Dr. Cohen. When is the appropriate time to raise concerns about a rush vaccine? Are you suggesting it's after it arrives here and is injected in millions of Canadians' arms? After Justin Trudeau announced back in May that he had reached a vaccine agreement with CanSio, a company with ties to China's military, Dr. Gill publicly spoke to ThinkPol about her concerns while she was allotted more words to express herself than what fits into a Twitter caption. True North reported that Dr. Gill stated, "The role of our government is to build trust through transparency and accountability. And if the Trudeau government wants Canadians to trust and buy into a SARS-CoV-2 vaccine, partnering with the Chinese Communist Party's military is the most counterproductive and dangerous thing it could do." Seems like a valid concern to be discussed prior to the vaccine arriving. Maybe it's just me. Even our own Chief Public Health Advisor, Dr. Theresa Tam, has recently casted her own doubts about the previously hyped vaccine. As seen on CBC, Dr. Tam, while referring to the vaccine, said, "We can't at this stage just put all of the focus into the hopes that this is the silver bullet solution." So what if Dr. Gill is right and Justin Trudeau was very, very wrong? Maybe we can get back to normal without waiting for an experimental vaccine. Take a look at this concert in Wuhan, China, which took place this past weekend, according to Global News. Thousands of people are packed together like sardines at a water park to listen to some good tunes during a global pandemic. Now, to be honest, I'm not sure even pre-COVID if it was ever safe to have that many people in a pool. It seems like people could drown quite easily, but that's just me. My point is, there's no vaccine available and they're back to normal. Another tweet referenced in CBC's one-sided coverage of Dr. Gill is this one that reads, "There is absolutely no medical or scientific reason for this prolonged, harmful, and illogical lockdown. Again, I am no doctor, but I have seen many reports suggesting that the lockdown measures have been both ineffective as well as put many people at risk in other ways than succumbing to the virus." Critical care doctor, Dr. Matt Strauss, tweeted a paper that he says is the first paper comparing actual outcomes rather than forecasts in different countries. The detailed analysis can be read at eClinical Medicine and concluded that full lockdowns and widespread COVID-19 testing were not associated with reductions in the number of critical cases or overall mortality. Just last month, Global News reported in an article titled "Coronavirus is Causing 10,000 More Children to Die of Hunger per Month, Globally UN," that all around the world, the coronavirus and its restrictions are pushing already hungry communities over the edge. So was Dr. Gill really all that horrible to speak out against a lockdown that, among other things, is killing thousands of children? And of course, CBC had to point out this tweet too. Humanity's existing effective defenses against COVID-19 to safely return to normal life now includes truth, T-cell immunity, hydroxychloroquine. A tweet which reportedly has now been removed from Twitter as well. I think we all know by now that doctors that come out and express their support for this affordable and broadly accessible drug are bound to be subject to some sort of cancel mob. Our very own Ezra Levant recently did a story here on Rebel News about how hard Facebook heavily censored a group of frontline physicians, including Dr. Simone Gold, after their press release that supported the use of hydroxychloroquine as a life-saving treatment option for certain COVID-19 patients. Mark Zuckerberg and hired fact-checker mob vigorously tore down the doctor's videos that were circulating across the Facebook platform. Dr. Gill and the doctors from that press conference are far from alone with their medical opinions that the highly censored drug should be put back on the table in order to help us win the fight against the virus. ABC's KITV4 Island News reported that a study of over 6,000 doctors were surveyed, and the consensus was that they found the drug promising. And yet another more recent example has occurred on August 13th when 3 US-based doctors wrote an open letter to Dr. Anthony Fauci regarding the use of hydroxychloroquine for treatment for COVID-19. The letter questions Dr. Fauci for saying the drug is unsafe when hydroxychloroquine has been used for over 65 years for malaria and over 40 years for lupus and rheumatoid arthritis as well. Adding that those of us who prescribe hydroxychloroquine, zinc, and azithromycin, doxycycline believe fervently that early outpatient use would save tens of thousands of lives. With all the backlash doctors get for speaking out in support of this drug, it's hard not to wonder how many more are in agreement with these people but feel they're unable to go public with their opinion about it. Failing to point out some of the other medical professionals who also agree with Dr. Gill's controversial tweets wasn't the only thing lacking from the CBC report. CBC also didn't draw much attention to Dr. Gill's professional character. Aside from being a frontline doctor working out of 2 practices in Ontario, Dr. Gill is also the president of Concerned Ontario Doctors. The organization, abbreviated as COD, works to make the Ontario and Canadian government aware of warnings that frontline physicians feel should be addressed. A COVID-19 related example on how Concerned Ontario Doctors does so can be seen in this letter they created on behalf of 10,000 frontline physicians in family medicine and other specialties throughout the province of Ontario. The detailed letter, written on April 14th during the height of the pandemic, was addressed to Prime Minister Justin Trudeau and Premier Doug Ford. The letter called for essentials that were lacking at the time, such as effective personal protective equipment, data transparency, mass testing, and my personal favorite, protection of all Canadians' civil liberties during the pandemic. 4 months later, and I'd argue we still haven't received that one. I tried to reach out to Dr. Gill to hear and have her discuss her battle to standing her medical ground, but I didn't hear back, and who could blame her after all the recent mainstream media attention she's received. Dr. Gill, if you're watching, the invitation is still open. We here at Rebel would love to have your perspective on the other side of the story. And for now, I will conclude with a tweet by Dr. Gill, where she addresses her supporters, including fellow MD colleagues, in spite of those working to stifle her medical opinion and free speech. She says, "My moral conscience won't allow me to silently watch people suffer and die when we have means to save them. Central to being a physician, Hippocratic oath, sacred doctor, patient relationship, and advocacy." I'm Drea Humphrey with Rebel News. Here at Rebel News, we think it's important to help you stay informed about the other side of the story, including that of the criticisms Dr. Gill is receiving. Now, we don't take a penny from Justin Trudeau's media bailout, so if you would like to support our journalism, please head to helprebelnews.com. We appreciate your support.